I'm Anna. I'm a registered nurse at Memorial Sloan Kettering Cancer Center in the Myeloma service. So as some of you may know, CAR T-cell therapy and bispecific antibody therapies have shown to be really effective as treatment for multiple myeloma patients. But since they are newer treatments that have been more recently FDA approved, there's not as much information on how this kind of affects patients and the burden of the treatment on the patient specifically. So to kind of find more out about that, we did a retrospective study looking at patients who were treated not on a clinical trial, for patients treated with CAR T as well as bispecific antibodies. And so we looked at those patients. They had to be strong responders, which we considered showing a response to therapy for at least 4 months. And then we only looked at patients as well that were treated specifically at MSK. And we wanted to kind of see what reasons this population are doing what we call unscheduled healthcare interactions. So that included calls to the physician's office, portal messages, trips to an urgent care, an ER, and then inpatient stays as well. So we can look through the charts of all of these patient populations to see and compare the difference between those on the bispecific antibodies and the CAR T of why they were having these unscheduled healthcare interactions. And so through that, we found that both these populations do frequently have these unscheduled healthcare interactions, but we found that most significantly the patients on bispecific antibodies tended to call more, or they did call more than patients on CAR T, and as well as they went to the urgent care more than patients on CAR T. And we found that the reason for this most prominently was upper respiratory infections in the bispecific antibody patient population. But that being said, most of these patients, even when they were calling or then going to the urgent care, even an emergency room for especially the upper respiratory infections, they didn't actually get admitted for that. So even though they were having these symptoms, it wasn't serious, it didn't require an admission. With all that together, especially from a nursing perspective, that we can help educate the patients more on what they can expect and how to manage these side effects at home, or manage them even without necessarily needing to reach out to the doctor's office or being evaluated in person when they're on these therapies.